It's reached the San Gabriel Valley. The measles outbreak that started in Disneyland a few weeks ago spread to 14 states and is now here locally. The CDC reports that of the 102 total cases reported as of January 30th, 17 cases of measles are in Los Angeles County and 3 cases right here in Pasadena. CCN's Hannah Townsley talked with Pasadena's Public Health Department's Dr. Ying-Ying Goh about what local health officials are doing to combat the disease.
I'm standing outside the Pasadena Public Health Department, where I just spoke to health officials who confirmed that there are 3 cases of measles in this city. One of the officials discussed the steps that the department is taking to bring awareness to the community.
We would like to start with communities that are serving children first, to make sure that parents have the information that they need to get their kids vaccinated. So we're reaching out to schools, public and private schools, with information, and of course the school nurses know that we're here available to them as a resource whenever needed.
Dr. Ying-Ying Goh says the Pasadena Public Health Department has also reached out to other healthcare offices so that people can have more information about the measles.
We have connected with certainly all our healthcare facilities, so the places where people would go if they were sick, including pediatricians and other doctors' offices, but also the urgent care and the hospital ER.
Goh says measles symptoms are similar to those of the common cold, which include coughing, high fever, runny nose, and skin rash. Doctors say measles can lead to death. Although there's no cure for measles, health officials encourage people to prevent getting the disease with an MMR vaccine.
So the vaccination is it's called MMR, which is measles, mumps, and rubella. It contains all 3 components of that. And that is the currently licensed vaccine available in the United States against measles.
But Dr. Rodarty says vaccines do have side effects.
The potential side effects generally are going to be you could get a fever, you could get a slight rash. Typically it comes on a little bit later after the vaccine, so it's not an immediate reaction. It might be a week to 2 weeks later. Certainly you can get local side effects as far as swelling or redness that you can get with any vaccination.
Throughout the country, a heated debate between those in favor of vaccinations and those against is taking place. Some anti-vaxxers worry about a possible link between vaccines and autism or brain disorders, but Rodarty says there is no link.
We could do a whole other episode on the myths about the MMR vaccine and side effects, which have really been debunked as far as worries about autism linkage and things like that.
Dr. Goh says the ages of the recent California outbreak range from infant to 70-year-old adults. She also explains the age that infants should get their first shots.
Typically we give children shots at 12 months or older, and then they get a second shot of MMR at around 4 years of age before they start kindergarten.
If you suspect that someone has any measles-related symptoms, the LA County of Public Health asks that you immediately contact your local public health department. In Pasadena, Hannah Townsley, CCN.